So optimizing sexual function for a male patient is actually one of the most common reasons that patients come to us. A very early and often troublesome symptom for patients that have low testosterone levels are low libido, which is low sex drive, and erectile dysfunction. And that's often what gets the patient in the doctor's door for evaluation. So it's obviously a mutual interest to try to improve those symptoms for both the patient and the provider. Now, optimizing sexual health is a very, very broad category because it's very multifactorial. There are obviously lifestyle factors, things such as diet, exercise, living a healthy lifestyle. I often tell my patients that a healthy libido is usually an indicator of a healthy life. Aside from lifestyle factors, there's also other factors such as other medical treatments, medications that they may be taking that may be having side effects with regards to their sex drive or their erectile function. Once we get past that layer of factors that are involved, then we get into the hormones specifically. And obviously from a hormonal perspective, testosterone and estrogen are very important variables for both men and women when it comes to libido and sexual function. So obviously reviewing lab results, seeing if they're in a hypogonadal state, which is low testosterone state, treating that if needed is a key pillar of improving sexual function. Beyond that, there are other ways that we can enhance or augment sexual function as well. Most patients are aware of the PDE5 inhibitors, as they're called, which are essentially Viagra, Cialis, and so forth, the medications in that class. We work with some preferred compounding pharmacies that offer very unique forms of those medications. One of my favorites are the troches and the ODTs, the oral dissolvable tablets. I prefer those over the regular oral capsules or tablets for several reasons, one of which is that it's sublingual. You apply it under the tongue and it dissolves directly into the bloodstream. It's typically a more rapid absorption, and you avoid having it pass through the GI tract and minimal absorption that can sometimes occur through that route. Also, another benefit in bypassing the GI tract is you don't have the first pass effect through the liver. So there's not as much burden on the liver, and again, you have more efficient delivery, more bioavailability. Another huge benefit, especially from a patient perspective, is cost. Those troches and oral dissolvable tablets often are cheaper than the brand name medications, and they can also be cut very easily. So patients can sometimes cut those troches or oral dissolvable tablets into quarters, thirds, halves, and they get multiple doses per single troche or oral dissolvable tablet in that way, and that minimizes their cost moving forward. So those are great products. We use them frequently and they're very effective for patients. So when those measures don't work, there are some more invasive and more aggressive approaches that we can take, specifically to improve erectile function in men. Those options are what we call ICI, or intracavernosal injections. These are injections that are actually administered by the patient, self-administered, in the corpus cavernosum, which is the spongy erectile tissue of the penis. Typically administered with a very tiny insulin syringe. Insulin needle, 31 gauge, 30 gauge, half inch is very common. Minimally painful injection, usually relatively painless in fact, and often very effective when the other measures fail. Options in this category include bimix, trimix, and quadmix. We use these only when needed, when other options fail for patients, but when they are needed, they're often very effective.
EndoPump is a powerful new formula for boosting male sexual health. It's different to every other solution out there because it targets the newly discovered root cause of